Good morning, Heart for the Community Initiative. Good morning, Enough. Good morning, Carl's Conversations. Hello, everybody out there on YouTube and on Facebook. Good morning to you again. Heart for the Community Initiative interview series is back with you, fulfilling our promise to keep the community informed. This morning, we have a very special guest. She has honored her with her time and her expertise. And we are hoping that you, the community, get the information that you need and that you desire. And we are also available for you if you have questions or comments. While we have this tremendous person with us, please feel free to comment. We have Dr. Alison Ansher. She is the health director for the Prince William District of the Virginia Department of Health. And she has agreed to come here this morning to talk to us, to give us some information about the COVID-19 virus, what's going on with the virus in the Prince William Health District, and also to give us some information on the vaccinations. And there have been so many questions about the vaccinations, especially from the Black and Brown community. Of course, we understand why. And so we are hoping that Dr. Ansher's presence with us today will give us some answers to our many, many questions. Good morning, Dr. Ansher, and welcome to Heart for the Community Initiative.
Good morning, and thank you for having me.
Wonderful. Can you hear me okay?
Yes, sir.
Wonderful. Well, I'm going to give the microphone to you if you want to begin to brief us on what's going on with COVID-19 in the Prince William District, and then we'll ask a few questions after your introductory comments.
Okay. Good morning, everybody. The Prince William District consists of Prince William County, Manassas City, and Manassas Park. So we have some urban areas and some suburban areas. In Northern Virginia, we have the highest percent positivity rate. That is, we have the highest number of cases per the number of people tested. The good news is we are testing. We've made a concerted effort as a community to ensure everybody has access to testing, not only just the insured, but also the uninsured. And most of our community testing has been geared towards selected areas where people tend to live in more crowded conditions, several generations perhaps living together. These are the folks that are out working and may have a greater chance of being exposed to a lot more people. And as we know, the more people that you're exposed to, the more risk you have of becoming infected. Because we know that about 40% of the people who are infected may not realize they're infected and don't have symptoms at all. Additionally, many of these folks either take public transportation to work or travel together in cars or trucks or whatnot. So that too also puts them at a bit greater risk of infection. The challenge for us is trying to ensure that we provide advice that is acceptable to individuals, or resources that are acceptable to individuals, as well as that they're aware of, to help them if they need to isolate or quarantine. Many of these folks also may not have sick leave. They may not get paid if they have to quarantine or isolate, and they may be tested positive but don't feel significantly sick where they feel like they can't go to work. So that's a challenge. The county has a motel for folks that are perhaps homeless, or that may have been exposed or infected, or for whatever reason in their living circumstances, they can't isolate or quarantine, and they're offered free of charge to stay in the motel for the time they need to do either. as well as provide food and actually other services. We have the Mason and Partners Clinic that could connect to those folks and provide them medical care while they're in the motel, and also connect them to medical services beyond being in the hotel for that time. The challenge is for some communities, you take care of your own. You take care of your family. That's not an acceptable alternative. And what we're finding is that in those, particularly in the Latino Hispanic families, that's what they believe. And so going to a motel would not be acceptable. So therefore, what we're seeing, unfortunately, is a lot of household transmission. Therefore, the story that struck me most is when we talked to the hospital was that they might have somebody from a household of that nature on a ventilator and go home on oxygen. And then the next thing they know, someone else from their family is now in the hospital on a ventilator and eventually will go home on oxygen. That sort of shocked me. Also, when people don't have access to care, their chronic medical conditions are not cared for appropriately or to the best that they can. And what happens is, as we know, those people are also at greater risk of severe infections with COVID. In our community, the largest number of hospitalizations and infections are the Latino Hispanic population.
Wow.
Yeah, we did a study with the CDC early in the summer on that population to understand, and a lot had to do with where they lived, and because they travel with others to work, there wasn't there wasn't as much of an understanding how protective face coverings are for not just you, but also not just others, but you. And so at that time, so we were seeing a lot of transmission. Additionally, some of these folks are day laborers. So
Right.
not only do they do not have access to healthcare, time off, what have you, it's hard to determine, they work at many different places. And so therefore have the potential to transmit the virus, get infected and transmit the virus to different work sites.
Wow. This sounds like much of the transmission is behavioral, and maybe there are things that people just don't know. We think we know, but we don't know.
Yeah, and that's the challenge. You're absolutely right. This is a change in behavior for the entire world. We don't, in the United States, we didn't walk around with masks on. We like to be social and close to people, particularly at significant events in our lives. So social distancing. There's been some positives, though. I don't think telemed would have advanced so rapidly had this event not occurred. A lot of places were dabbling in telemed, but didn't use it to the extent that they have through COVID. And so we now recognize it's a good medical tool for certain healthcare conditions or certain medical uses. So that's a positive. And I think as time has gone on, we've learned more how to treat people who become hospitalized better. So we are seeing less people in Northern Virginia on ventilators. So that's good news. So they're more likely to leave the hospital. Sometimes out of something negative, something positive occurs, like telemed.
Wow. Here's a question, Dr. Ansher. One of our viewers wants to know, how does Prince William County rate in terms of hospitalization compared to other areas of Virginia?
Okay. When we talk about hospitalization in Prince William County, we don't look at just our hospitals. We look at the whole Northern Virginia region because The different hospitals may have different specialties, or have the ability to care for different types of patients. I don't want to say better, but they're set up to do so. So we look at our hospitals in Northern Virginia as a region. Now, in Northern Virginia, we are doing okay as far as availability of hospital beds. About 80% of our hospital beds are filled. We are seeing an increase in the number of people going to the emergency room for COVID-like illness. That does not mean they'll get hospitalized. It will mean that it could mean they'll get hospitalized, but it can also mean that they are tested and given treatment in the hospital and sent home. But our ventilator use rate in the Northern Virginia area is only at about 28%. Now, are we concerned? Yes, because we're seeing an increase in hospitalizations. To give you some, hospitals tend to plan for 120% capacity. So being at 80% capacity, even though it sounds high, and it is much higher, it has slowly creeped up, there is still room. We're grateful for the people that did heed the warning and got the flu vaccine, because normally this time of year, you're aware that our emergency rooms often become quite busy with people who are infected with flu.
Absolutely.
Yeah. I think we're somewhat lucky in Northern Virginia for all the medical resources we have, but we are watching it closely. The challenge with COVID is that we can't reach out to, let's say, Fauquier County or what have you if we become overwhelmed, because we're all in the same situation. So that is a challenge for hospital systems.
Thank you for that. When it comes to testing in the Prince William district, how available is the testing, and where can our viewers go to find out whether, because I'm sure organizations host testing all the time, and most of it is free. Do you have a way of communicating to us the availability of testing in the Prince William district?
Yes. The Prince William Health District developed a testing task force early. And this consists of both governmental as well as community leaders, Board of County Supervisors, et cetera, who know their communities well. So we've used their expertise. We also have some religious leaders on the task force. We have been testing in the community, smaller testing sites, as I mentioned, almost every day of the week. Not Sunday, but some Saturdays at different hours, so that we can reach those hard to reach communities. These tests are free. Because of the increase around after Thanksgiving, we hope we don't see the same around Christmas and New Year's time. What we've done is we've reached out to the state, and we've had 2 large testing events that were free. Last one was done on the 17th, where 500 people could have been tested. They've all been drive-throughs. If you go on the Prince William County website, pwc.org /COVID coronavirus, there's a place that you click that says testing, and it'll give you the lists of times and days. The health district is going to be less involved in the testing because we're going to be very involved in the vaccination, but the community has done a great job to keep that going. We hope that CARES funds gets extended, or other funding, because that's really helped us continue to have events continuously for free. For those, we're encouraging that for those that have alternatives, certainly can go to the free sites. But also there's other urgent cares, et cetera, all over the community that are doing testing.
Thank you. And I want to tell people, like I have done, if you're concerned, contact your primary care physician. You can absolutely get tested at your primary care physician. Your insurance most likely will take care of it. That's been my own personal experience. I do want to ask you, here's a comment. With approval of 2 vaccines, when can the community expect to have access to a vaccine? That's from one of our viewers. Thank you, Dana.
Hi, Dana. I'm going to tell you what I tell you today may change tomorrow. For instance, we were expecting in Virginia enough vaccine, Pfizer vaccine and Moderna, anticipating Moderna would probably be approved. It's been approved by the FDA. We have to wait for the Advisory Council on Immunization Practices, which we're pretty sure will approve it and give us guidance beyond the healthcare workers and the long-term care facilities. Who's next? We anticipate, it's dependent on having enough vaccines to be able for everybody to get vaccinated. We had expected to receive enough vaccines in December to be able to vaccinate all our healthcare workers, as well as our healthcare workers that work in long-term care facilities, as well as the residents. We found out yesterday we're not getting not just us, all over the country, we're not getting as much vaccine as we anticipated. So it's a daily struggle. Every day is different. We're hopeful that we'll be getting the Moderna vaccine. It'll be approved and it'll be shipped on Monday. We're still, in the process of vaccinating healthcare workers. The good news is when we talk about healthcare workers, it's not just providers. It's also people who
support services.
So that helps somewhat. Not only do we have obviously brown and black clinicians, but we also have those in the support services. So it helps a little bit with equity for that reason, because it's not just healthcare providers. It's other folks that could be at risk. We're hopeful in the spring that we will have enough vaccines. Also, what the state of Virginia has done, and probably many other states, they have partnered with commercial pharmacies when there's enough vaccine to also provide vaccines to the community. Kaiser has been a wonderful partner. In DC, they're helping vaccinate the folks that are getting vaccinated now, the healthcare workers. In Virginia, we're hopeful that they'll do the same beyond their healthcare workers. And in Northern Virginia, in Prince William, they have a huge footprint, Kaiser. We believe that they have about 37,000 clients. Wow. But remember, that's children too. And at this point, we're not vaccinating children. The vaccines at this point are only approved for adults. The Pfizer for 16 and older. Right now, the Moderna 18 and over. By that time, they and other vaccines may be approved for children too.
Wonderful. Here's another question, Dr. Ansher. Dana asked, she says, I'm a healthcare provider. She's a nurse practitioner, but I don't work in a hospital. Right. How soon will I get a vaccine? I understand that those who are more likely to come in contact with the virus need to get it first.
If you work I can tell you how it works in the Prince William Health District. If you work in the Prince William Health District, we have a call center, or you can email me. And what we're doing is we're collecting information on practices that are just in that situation. I had sent out a letter to all the practices. We blast faxed it that we were aware of in our community. and ask them to email us with the number of providers in their practices, and this is ones that are not connected to the hospitals, in their practices that need to be vaccinated. We're starting with, we're getting a very small amount of vaccine, we hope next week. And we're starting with our EMS providers because they are obviously coming face to face with both COVID and potentially COVID patients. So we're beginning there. And from there, we will be expanding into, as we get more vaccine, we're going to have a closed point of dispensing site, help our providers such as you in your practice sign up for particular appointments and have you come in and get vaccinated. Our challenge is access to vaccine, as it is for everybody all over the country.
Wonderful. Here's another question. This is a good one. This is from Princess. In the Black and brown communities, there are distrust of the vaccine. What actions or campaigns are being put in place to provide confidence in the safety of the vaccine? Thank you, Princess. That's a very good question.
What the Virginia Department of Health has done, I think they just finished up. They have reached out to different communities and had an open forum where they were just listening to trying to understand what the concerns are and how they should focus their media campaign for not just also folks of the LGBT community, people in the brown and black community, and other folks that might have some concern. Let's be honest. I believe probably a lot of us have some concern because of getting immunized. Of course, we understand the reason behind the black and brown community, their hesitancy for getting vaccinated. Additionally, we in the health district have just recently put out a survey to sort of get an understanding, who's willing to take the vaccine, who is not, and why they're not, to give us an idea. Additionally, the Virginia Department of Health, their risk communication department, has hired a vendor to do just that. Number one, to help with communications, but also to look at the information that's going in the media, whether it's Facebook, Twitter, etc., whether it's on TV or radio, to try and understand what kind of communication, what kind of myths about the vaccine, what truths about the vaccine need to be communicated, so that a more tailored communication campaign can occur. I think one of the things we need to know and is personally, and I'm not meaning to say anything political, but personally, there's going to be certain people that get vaccinated that mean nothing to me because they take the vaccine. That's not going to influence me one way or another. We do need to know in various communities, whether it's the Black community, the brown community, who would matter to you? Who would make you, who do you trust? And that's the kind of information we need. And that's who we need to connect to so that you feel comfortable with the information you're getting. And if that person or those people should choose to get vaccinated, perhaps why they're comfortable getting vaccinated. And that would probably resonate better with you.
Thank you so much. Here's another question. I'm so glad that the audience has questions. You're doing right while we have Dr. Ansher here. They want to know there are concerns regarding the vaccine among families who are trying to have children. How are those concerns being addressed?
Okay. I'm going to be frank. There hasn't been um, a huge number of pregnant women who had been studied in the for the vaccine, but we do know it's a risk benefit balance. We do know pregnant women uh, do much worse with COVID. They have a higher risk of having severe disease. They also have an increased risk of preterm labor. So it's a risk balance. It's a discussion you need to have with your provider, because your provider knows other health issues that, we can't just take this category and say everybody does the same thing. I will tell you, obviously, people who have also chronic medical conditions and are trying to get pregnant, whoever you are, whatever time it is, you need to make sure that those medical conditions are under control. Particularly with COVID, where people with chronic medical conditions in general, pregnant or not pregnant, are not faring as well and end up with more severe disease. But your healthcare provider knows you best. I will tell you, the American College of OBGYN came out not discouraging the vaccine, but did also recommend that it's a discussion you need to have with your provider, because they know you best and help you make that decision.
Thank you so much. Here's a hot question. For someone who has already been infected with the COVID-19 virus, should they take the vaccination? And if the answer is yes, how far after the infection should they wait for vaccination?
Okay. Yes, you should take the vaccine, because we do not believe, but we do not know for certain, that the immunity to the COVID infection after you've had it is long lasting. We are seeing people with reinfection. So it is recommended, even if you had the COVID vaccine, it's not recommended that you get serology to show that you've had the infection. It is still recommended that you get the vaccine. Now, we do know that people generally do maintain some protection for 90 days. So if you've had a COVID infection within the last 90 days, you may choose to wait, but you can also choose to get vaccinated. Now, I'm going to qualify that, because people who have immune conditions, perhaps cancer or cancer treatment, an autoimmune disease, so they're on some medicine that may impact their immune system. We don't know as much about how much protection one gets or the length from having a COVID infection. So yes, you can get the vaccine.
All right. And some people also want to know, okay, if I've had the vaccine, do I still want to wear a mask? That is a real question, and please let them hear you answer that.
Absolutely. Number one, there's for the 2 vaccines that are out, there is also requires 2 doses. So after 1 dose, you don't wham, you're protected. Even after 2 doses, it takes time for your body to make antibodies against a disease infection organism, whether it's a virus, whether it's a bacteria. But yes, you do still need to, because at this point, we don't know how long the vaccine protection will last. There's ongoing studies. So you still need to social distance. You still need to wear your face coverings. You still need to wash your hands frequently. Nothing will change. As time goes on, as we have more information, we'll know better. You have to remember, at this point, this is just a tool in addition to the social distancing, the face coverings, the hands washing, because number one, would need a whole lot of people vaccinated to ensure folks are protected. And that takes a lot of time. That takes a lot of vaccines. And we're not certain, again, how long you'll be protected even after 2 doses of these 2 vaccines.
So it is possible that once we get the first vaccination, I guess as more information is available, there could be, it may be 6 months, 9 months, a year, we may need to get vaccinated again. I guess like the annual flu vaccination.
Yes, we're just not sure. It could be.
Okay. Here's another question. That's a burning question, Dr. Ansher. People want to know, after I have come in contact with someone that I know to be exposed, let's say they get results back today, and they had no idea. So they called the friends that they hung out with yesterday and the day before, said, listen, I just tested positive. How long should those persons wait before they go get tested?
Obviously, if they have symptoms, they should go get tested immediately. If they don't have symptoms, it takes time for us to have enough enough virus to get a real accurate test. The best time would be 5 days to 7 days after you were exposed, the last time you were exposed to that individual. Now, obviously, again, if you have symptoms, you go ahead and get tested. You may be aware there's 2 kinds of tests. There's one test that we all call a rapid test. It's actually truly an antigen test. It works better, and it was actually FDA cleared to be be used in people who have symptoms. That's when it's most accurate. Then there's another test that you might have heard of, PCR, that takes a little longer to come back. That is accurate for both negative and positive. Yes, an antigen or a rapid test can be used to be screened to see if somebody's infected. The benefit is that if you are positive, you will get that information back within 15, 20 minutes. The disadvantage is it's not as accurate. If somebody's negative, it's not as accurate as the PCR test. But even if you get a negative test, you still need to quarantine because you are a close contact to an individual. And we do recommend the 14 days. CDC recommends the 14 days because that gives us the best chance. If you don't develop symptoms in that time and you don't test positive, that means you weren't infected. You may have heard that there's 2 other shorter intervals that people can quarantine. It's not 14 days is recommended, but we understand some people cannot quarantine for 14 days. So the 2 other ways would be 10 days without symptoms, or 7 days without symptoms, but within 48 hours before you discontinue quarantine, you need to have a negative test. So again, those 2 other variations do come with risks. You still have, with a 10-day, about a 5% chance of still developing symptoms or testing positive. And with the 7-day, it can be as high as 10 to 12%. So that's why we do recommend the 14 days. But we understand, number one, we're finding people may not do the 14 days, unfortunately. But we all understand there's circumstances where people cannot quarantine for 14 days.
All right, Dr. Angela, one more question while we have you. Princess asked, FDA authorized first COVID-19 test for self-testing at home. Do you have any information on the home test?
No. We do know there's 2 that are that were approved. I'm not sure exactly when they'll be shipped and available. One of them does concern us because it is a home test. you read it and you have the information, whether it's positive or negative. Our concern is that individual who tests is supposed to let the health department know whether their test was positive or negative. We have no guarantee that that will happen. Right now, the other tests that are done in laboratories or at a provider's office, the results are electronically transferred so that the health department can see and reach out to those who are positive and ensure that they are isolating, be given advice about what to do if they get severely ill, as well as find out who their contacts are and talk to the contacts, give them health advice, and give them information about where they can get tested and other resources to help them be able to quarantine, whether it's food, whether it's rent assistance, and that sort of thing. There's another test that was just approved. That's a home test, but it's connected to a telemed so that you actually speak to somebody who can educate you and provide you information. Should you be positive? Should you be negative? And those tests will be reported to the health department so that we can follow up and ensure that you have the resources you need, and also have information about your contacts. And particularly important if your contacts are at high risk or if there is an outbreak in a very sensitive type of environment like a long-term care facility.
Wonderful. Thank you. And I'm imagining that people who do not have a primary care physician, can they go to the Virginia Department of Health website or the CDC website to get information about what they should be doing for self-care?
Absolutely. And if we know that they're positive or negative, we certainly provide them information, can send information. Most of the government, Prince William County, Manassas City, Manassas Park, we share information with them, so they put it on their websites too, and vice versa. So yes, going to your the CDC is great information. It's truthful information. But to be honest, we do sometimes find that it's can be a little wordy or challenging for some folks to read. We've tried, they've done a better job about doing infographics. We've learned our lesson too, to do more infographics to sort of provide people choices of how to avoid transmission. We realize that some people, because of their living circumstances, just can't isolate very easily. So giving them alternatives. So we've learned our lessons too.
Well, Dr. Ansher, we are so happy that you spent some time with us this morning. We do value your time. You could be doing so many things this Saturday morning, but you spent some time with us, and our audience had many questions. Thank you for taking the time. You didn't only answer them, but you answered them and then some. So we thank you. I want to know, before we conclude, is there anything that you wanted to communicate that maybe you and I didn't have a chance to go over?
Yeah, luckily somebody asked the question. Number one, we hope people did get their flu vaccine, so they're not and don't end up infected with both and could do really poorly. Also, please, I know it's tough. Behavior change is tough. But do wear your face covering, do social distance, do wash your hands. If you have the ability to telework, that your work site allows you to telework and you can do it, that's great. That's helpful to help prevent transmission. Take care of your loved ones. I know it is tough during holiday season, not being able to be close to our loved ones. But unfortunately, what happened, as we sort of predicted, or Dr. Fauci also predicted, after Thanksgiving, we've seen our number of cases rise dramatically. And some communities, their hospitals are in bad shape. So we've already had the after Thanksgiving rise. We hope not to add on after Christmas and after New Year's, where we see another huge increase in cases, which may severely stretch our medical capacity. You have to remember, it's not just having beds in a hospital, it's also having staff to be able to provide care for patients. And if they become exposed, they have to quarantine or isolate. If they get infected, healthcare providers also have to isolate. So it's a balance. It's a balance. So please, 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 just for this Christmas, just for this New Year's, we're hopeful that next year will look different. But please continue to do those, mitigation strategies. They've allowed schools that have done well with those strategies have prevented transmission in the schools. They work.
Thank you so much, Dr. Ansher. And I want you to know that anytime you have information to put out, whether it be you or someone from your staff, you always have a place with Heart for the Community Initiative and Carl's Conversations. I hope that we can stay in touch. And like I said, anytime you have something to put out or we get inundated with questions, hopefully we can come to you and maybe you can come on and keep the community informed. We thank you so much for your time this morning.
And thank you for having me.
Yes, ma'am.
Weekend.
Yes, ma'am. Well, Heart for the Community Initiative, you have heard it. That was Dr. Alison Ansher. She was wonderful to spend some time with us this morning. We're very thankful for her. And hopefully this interview was informative to you. So we've done it again. Hopefully, like I said, it's been, thank you, Dana. And thank you, Princess, for your comments and compliments. We are trying to do the best we can. There'll be some more information forthcoming. Groups like Enough and Stafford Black, the Stafford NAACP, and many other groups are doing all they can to keep you informed and to host events and to do things that will be helpful to the community. All right. So until next time, may God bless you and may heaven smile upon you. For all of you who follow Heart for the Community interview series, this coming Tuesday evening, the 22nd of December at 7 p.m., I'm going to be interviewing Mr. Lee Mooring. He is a tremendous part of our community, tremendous entrepreneur, life coach, business owner. He's a great guy, United States Air Force senior NCO retired. Stay tuned. Tuesday at 7 p.m., Mr. Lee Mooring is going to be a great interview. All right, until next time, God bless you.